Welcome to MDCO Health Center, the first and only ambulatory hospital in the Bahamas. We provide all clinical services required to allow you to have medical care and surgical procedures done, which allow you to go home on the same day. The health center has several departments: a pharmacy, medical clinic, clinical laboratory, a surgery center, and a dental center. The pharmacy. Frank Prempe is a fully trained and licensed pharmacist. In addition, he has pursued additional training to obtain his doctorate in pharmacy. This is the highest qualification available in pharmacy, and few pharmacists in the Bahamas have this training, which is competitive and difficult to obtain. In addition to dispensing drugs, our pharmacist can assist you with understanding the medications you are taking. He can also advise you if there are side effects that you need to look out for when taking your medication. And in addition, if there are interactions between medications that you need to be aware of when taking more than one prescription. Blood pressure measurements are also available in the pharmacy. Drop by, say hello, and have your blood pressure checked. The George A. White Medical Clinic is situated on the ground floor of the medical center and is run by Dr. Gloria Ajib, a family physician with over 20 years of experience. A general medical clinic should be the first stop for all your medical needs, as many minor ailments can be taken care of there, thus avoiding more expensive care by a specialist. The medical clinic provides well baby checks, sick certificates, as well as treatment for aches and sprains, high blood pressure, diabetes, cold, flu, gastritis, ulcers, and many others. The clinic is open from 8:30 a.m. to 4:30 p.m. We accept patients both with and without appointments, and will schedule appointments on some weekends and evenings with prior arrangement. Of course, we recommend appointments whenever possible, as you will be seen more quickly, and we will be able to prepare more thoroughly for your care. And now on to our clinical laboratory. Angie MacDonald is a laboratory technologist and is director of our laboratory. Angie has over 20 years experience working at several hospitals and clinical laboratories throughout the Bahamas. She is truly an asset to our facility, and we are lucky to have her here. We have facilities to do all routine lab tests, including blood work, urine tests, cultures, blood typing, and pregnancy tests. No appointment is necessary, and you can usually have the results the same day. The IA Farrington Surgery Center is a fully equipped surgery center capable of providing services for a wide range of surgical procedures. For example, gallbladder removal, hernia repair, dental surgery, tonsils, ear surgery, orthopedics, D&Cs, laparoscopy, arthroscopy, and so on. All licensed surgeons are eligible to work at the center. They simply need to provide their credentials, medical license, and evidence of malpractice coverage. If you are contemplating surgery, feel free to stop by the first floor to make inquiries. We waive the co-insurance obligation for all major insurance companies. The surgery center is run by Nurse Sandy Bain, who has over 30 years of nursing experience. We are lucky to have her. Nurse Bain is assisted by Lubin Pierre, our surgical technologist. Lubin has worked for many years at Princess Margaret Hospital and comes to us with a wealth of experience. The Farrington Surgery Center was built with entirely new construction. Thus, we have been able to incorporate all the latest in modern medical technology. Endoscopy, also known as keyhole surgery, is the area that we specialize in. We do any type of surgery suitable to allow patients to go home the same day. Endoscopy is the latest in surgical technology and involves performing surgery through very small holes. using very small telescopes and powerful lights. The advantages include smaller incisions, minimal or no scars, less pain after surgery, and faster recovery. There are two types of endoscopy, arthroscopy and laparoscopy. Both types are performed here at MDCO and are not currently available at Princess Margaret Hospital. Arthroscopy is used to treat injuries in joints such as knees, shoulder, and ankles. Special miniature cameras are inserted and project images from inside your joints onto a big screen. With the aid of this advanced technology, doctors can treat your injuries without the need for large incisions, which take a long time to heal. Hence, small incisions, faster recovery, less pain. Laparoscopy is similar to arthroscopy, with the only difference being that gas is used to expand the abdomen to give surgeons more room to work. Many surgical procedures may now be done laparoscopically. Examples include tubal ligation, removal of fibroids, cysts, polyps, gallbladder, appendix, and hernia repair. Once again, less pain, faster recovery, fewer complications, smaller scars. In fact, laparoscopy has become internationally the new standard of medical care for many procedures. By way of example for laparoscopy, here you see excerpts from a laparoscopic removal of a gallbladder. The film clips illustrate the dissection of the gallbladder from beneath the liver. It is then removed from the abdomen through a small hole as shown here. Let's take a quick photo tour of the first floor. Here you find the surgery center, clinical laboratory, and the office of Dr. Robert Gibson, orthopedic surgeon. Dr. Gibson is one of the premier orthopedic surgeons in the Bahamas and does his outpatient surgery exclusively at MDCO. The door to your left in the red arrow opens into the clinical laboratory. The glass door to your right, green arrow, opens into the financial services office where billings, payments, and scheduling of surgery are taken care of. In the distance, you find the reception area for all services offered on the first floor. The yellow arrow indicates the entrance to the offices of Dr. Gibson. You are now looking at the scrub area, where surgeons and their assistants clean their hands and arms prior to putting on sterile surgical gowns. Sterility is very important in surgery in order to prevent infections. Next, you see the main operating theater where surgical procedures are performed. Here you see Dr. Gibson at work doing a knee arthroscopy. You are looking at the preoperative assessment area where patients are assessed before surgery and have last-minute discussions with their doctor. Here you see a patient just prior to the induction of anesthesia. Here the anesthesiologist is beginning induction of the anesthesia. The anesthetic equipment used at MDCO is the latest technology providing maximum safety and comfort. Here you see the recovery room where patients wake up from anesthesia. Unlike most medical facilities, we allow family members and loved ones to be with the patient during recovery. Seeing a familiar face or hearing a familiar voice is always reassuring as one recovers from anesthesia. Now we move on to the MDCO Dental Center. Located on the second floor, the MDCO Dental Center is the oldest division of MDCO. We have 10 dental operatories in an ultra-modern facility, complete with a fully digital, paperless work environment. As a result, we can send by email reports, x-rays, anywhere in the world. In addition, we have one of the few Panorex machines on the island. With this machine, x-rays of your entire mouth may be taken with just one x-ray, providing more efficient care and, most importantly, reducing your exposure to radiation. We currently have 5 dentists working at the MDCO Dental Center. We have 3 general dentists, an oral surgeon, and an orthodontist on staff. Dr. Ulysses Camacho, Dr. Charles Forbes, Dr. Michelle Mackey, Dr. Duran Monroe, and Dr. Munira Rashad. In addition, we have a full-time hygienist, Mrs. Alicia Sands. Dr. Camacho graduated in 1999 from the Faculty of Dentistry at the Higher Institute of Medical Sciences of Havana. Dr. Camacho did an additional 4 years of specialized training in orthodontics, the branch of dentistry that specializes in the diagnosis and treatment of teeth that are poorly aligned. This specialty involves the design and application of braces to bring the teeth and jaws into proper alignment. Dr. Forbes graduated from Howard University School of Dentistry in 1993 and is interested in general dentistry. Dr. Mackey graduated from Marquette School of Dentistry in 1994 and is particularly interested in pediatric dentistry. Dr. Monroe graduated from the State University of New York School of Dentistry and has implant dentistry as his special interest. Dr. Rashad graduated from Howard University School of Dentistry in 1971. He then completed 3 years of additional specialized training in oral surgery before entering practice. He has over 30 years' experience in practice. Mrs. Sands graduated from the University of Missouri, Kansas City in 1994 with a degree in dental hygiene. We will now take you on a quick tour of the dental floor. Here is a sample dental operatory. Each operatory is outfitted with computer and internet access for immediate recording of patient information and access to dental records. Pink arrow. In addition, each room is access to digital X-ray equipment. Yellow arrow. Here you have a view of the dental surgery theater, where Dr. Rashad performs oral surgery. This surgical theater is outfitted with all necessary equipment for providing general anesthesia in a safe, hospital-like environment. Children and adults with a fear of dental care may be treated in a safe, stress-free environment. Medical Center Conference Room is located on the dental floor. This room is equipped with audio-visual equipment for meetings, patient conferences, and general staff continuing education meetings. The MDCO Health Center focuses exclusively on outpatient medicine because specialization in this area allows for a higher level of performance. It is difficult to do everything well. Major medical centers are good at trauma, heart surgery, and saving lives under stressful, difficult circumstances. They tend to be not as good, however, with preventive medicine and care of patients who require medical attention, but not necessarily emergency care or life-saving technology. MDCO Health Center aims to provide you with a warm, supportive, tranquil environment where our doctors will take the time to listen to you and you receive the latest in medical care, but without the stress, hustle, and bustle of a busy trauma center where, frankly, the focus is on saving lives and not necessarily on making your hospital experience as pleasant and comfortable as possible. The mission statement at MDCO Health Center is Service First. Service: safety, efficiency, relevance, value, innovation, comfort, education. First: future, innovation, responsiveness, safety, technology. MDCO Health Center, raising the bar of healthcare for you. MDCO Health Center, raising the bar of healthcare for you.